Welcome to the Total Joint Seminar at Carle. We present this class to provide information to assist you as you prepare for your total knee or total hip replacement surgery. We will be reviewing information regarding prior to your surgery, talking about information to think about your home, your support system, and yourself. What to expect while you're in the hospital, and what to expect when you go home. If you would please have your booklet, the total joint replacement surgery that you were given at your appointment or mailed to you throughout the presentation so that you can take notes during the seminar. Areas that we will cover during the presentation are your care team, getting your home ready, getting your body ready, your hospital stay, and going home. Your care team, as we go through this presentation, you will notice that your care is truly a team effort. Each one of these roles will be discussed during the presentation. This starts out with your surgeon's office, and including your surgeon, the clinic nurses, also including physical therapy, occupational therapy, case managers, social workers, and the hospital nursing staff and staff at the hospital. These staff members all have key roles in ensuring that you have excellent results from your surgery. One of the most important roles for your surgery and throughout your surgery is your coach. Your coach is that person that will be with you throughout this process, and we ask that you identify that person if you have not already. We will talk about the role of the coach as we're going along and the importance of them throughout your surgery and your recovery. Getting your body ready prior to surgery. Some patients require a medical clearance as their cardiologist or pulmonologist prior to surgery, and those appointments will need to be scheduled in coordination with your primary care physician or surgeon. All of our patients are given a sheet of medications that you may need to stop prior to the surgery. You should have been given this paper with your packet of information from your office visit. Please review that prior to the surgery, as most of these medicines are medicines that can interfere with the blood clotting. So these are medicines as like anti-inflammatory medicines like Aleve or ibuprofen, medicines of vitamins or herbal supplements. If you are on a blood thinning medicine as Coumadin or Plavix, please refer to your surgeon's instructions or your primary care instructions regarding stopping these medicines before surgery. Please do not stop any blood pressure medicines or heart medicines prior to surgery. If you do have diabetes, we ask that you keep those under control prior to surgery. And regarding smoking, request to stop smoking 30 to 60 days before surgery due to the lungs and having general anesthesia and the increased risk of pneumonia after surgery. During the flu season, we do recommend that you have a flu shot, but we request that you do not have the flu shot 2 weeks prior to your surgery or 2 weeks after your surgery. All of our patients are required to have a pre-op physical prior to surgery. That usually happens within 2 to 3 weeks of your surgery. And including this would be a medical exam, lab work, possibly EKG, and one of the screening tests that all of our surgeons require is called a MRSA screen, or MRSA. And that is screening for a particular staph bacteria that can be in our body and not be active. And then when we have surgery or a stress to our body, it can become active and cause problem for infection after your total hip or total joint. So we ask that when you go to lab, that you make sure that the lab tech does the nasal swab for the MRSA screen. If it is positive result, the surgeon's nurse will contact you prior to surgery with instructions. Prior to your surgery, the afternoon before your surgery, the nurse, the pre-op nurse, will call you to go over some information. And this is the business day prior to your surgery. So if your surgery is on a Monday, it would be on a Friday. And they will call you between 1 and 5 in the afternoon. Things that the nurse will cover are time to report to surgery, what time to report, and where to report to at the Carle Hospital. The nurse will also go over what medicines, if you are to take any medicines the morning of the surgery with just a little sip of water. The nurse will also review when you are to stop eating and drinking. They'll be very clear about the time, because that's very important that you follow those instructions so that your surgery does not get canceled. In your packet of information from your surgeon, you should have received a surgical site infection prevention instruction sheet. Please refer to that prior to the surgery, as it will give you instructions on showering prior to your surgery. We request that you shower with a special kind of soap. It's called a Hibiclens, and it's spelled Hibiclens. Again, that's Hibiclens. And the name of the soap is on that sheet, instruction sheet. And you can purchase it at any type of pharmacy or stores as Walmart, Meijer, and it would be in the pharmacy section. It's a liquid type of soap in like an off-green kind of bottle that you can get at the store. There's instructions on the sheet as far as showering from the neck down, avoiding with your private area, but showering from the neck down. So you can use your normal product you use for your hair and your face, and then use the Hibiclens from the neck down. We also request that you not shave from the neck down for 3 days prior to the surgery, because we don't want any nicks or cuts that may be an avenue for bacteria. The night before the surgery, after you've showered with the Hibiclens, to sleep in clean sheets. And we ask that if you do have any pets that sleep with you, that they not sleep with you that night. The next morning when you wake up, to take your shower, and then wear clean, loose-fitting clothes. We ask that you not apply any lotions or powder or deodorants or colognes or perfumes, or no makeup the day of surgery. In the time between your pre-op physical until your surgery, if you do experience any illness or skin rash or any problems like that, or any illness, infection like cough or fever, please call your surgeon office. If you have any dental problems, we ask that you call us, because we request that you not have any dental work for 3 weeks prior to the surgery. Or if you have any family emergencies, or something come up the night before the surgery, you would need to call the patient advisory nurse. And that phone number is on a list of phone numbers that you received with your packet in your total joint booklet.
Okay, so next we'll talk about what to expect during your hospital stay. Anticipate getting up with physical therapy or nursing the same day as surgery. We would like to have you walk 3 times a day with therapy or with nursing, always with a staff member while you're at the hospital. That way you can increase your walking distance and get you ready to go and leave the hospital. Other things we'll go over with you with physical therapy will be transfers in and out of bed, getting up from a chair, and also stairs as well. So when you come to the hospital, make sure you know approximately how many stairs you have in your home or how many you will have to do. We will make sure that before you go home that we try stairs with you and make sure that those are safe. Also during your hospital stay, we'll go over some exercises and we'll give you a booklet for those. Just so exercises that you can take home with you after you leave the hospital and do there. And then we also would like you to get up in the chair during your hospital stay and multiple times a day. Getting out of bed is good for your strength and conditioning as well. With occupational therapy, they'll come in a little bit later, but they'll work on dressing, bathing, getting up and down from the toilet and other toileting activities, just general activities of daily living.
In thinking about going to the hospital and some things to bring with you, for clothing, we ask that you bring another set of clothes to go home with. We recommend that they're loose-fitting type of clothes because either with a total knee or a total hip, you're going to have some swelling at the leg. So in the summertime, it's best like shorts or capris that are a little bit looser. In the winter, the sweatpants, something that will accommodate that if you're having a little bit more swelling at that leg. For shoes, we recommend that you have supportive shoes, not any flip-flops, and the shoe that would have good traction and so that your foot would not slide out of the shoe. If you have glasses or dentures, we ask that you do bring your coach would bring the case so that when you're not using them, that you can have those in the case there by your bedside table. For the hospital, if you use a CPAP machine at home, most of our patients want to bring their own mask or nasal pillow with them, and that's perfectly fine. Again, having your coach to bring that up to the floor after your surgery. If you don't want to bring anything, it's fine too. We have all of the equipment needed, or if you want to bring all of your equipment and have it in the car, that would be a recommendation. A walker. If you do not have a walker or you have someone that you borrow a walker from, if you do need a walker, you can contact your surgeon's office prior to surgery to order the walker for you so that you will have it available. If you do not, we can order a walker when you're at the hospital. The physical therapist will go over what type of walker we recommend a little bit later in this presentation. Things that we do not recommend you bringing, like valuables or money, again, relying more on the coach for those assistance. Medications. Please do not bring your medications from home. There are a couple of exceptions, but primarily we want to avoid any persons giving themselves their medication from the bedside table, and then we give the same medicine as ordered by the doctor. The exceptions that I mentioned would be is if you had a very specialty medicine that was made in a special formulary, or patients with asthma or breathing problems that have a rescue inhaler, to bring those, and then once your coach brings those, we will give them to the nurse for them to put with your other medications. When you arrive at the hospital, the pre-op nurse will have given you the instructions to which area to report to, either to the registration or go directly to the second floor of the surgical waiting room. And you'll check in there, and then they will come and get you to go back to the pre-op waiting area or pre-op area to be prepared for your surgery. You'll change into a gown, and then an IV will be started. At some point there, your coach or your family member is usually that they are able to come back and stay with you until you go to surgery. Anesthesia. You will meet with anesthesia. Anesthesia will go over your risks and your sedation. You will be completely under general sedation. They will also want to know if you have any allergies, or if it has taken you a long time to recover from anesthesia in the past, or if you've had any reactions like nausea or being sick to your stomach after receiving anesthesia. And that is important then to have your coach there that they can help answer some of those questions. After anesthesia meeting, the anesthesia will also go over a couple options that they will discuss, which are called nerve blocks, that help with some pain control. Some of our surgeons do order this, and the anesthesia will discuss this with you. There's a certain type of block for the total knee replacement and for the hip replacement surgery. After the anesthesia talks with you, then you will be going to the operating room. At that time, your coach or your family members or friends would be directed back to the surgical waiting room. They're given a pager so that they can keep track of where you are at in the time of surgery, and will be given updates throughout that time. After your surgery, you're moved to the recovery room, and you will be receiving frequent monitoring with your blood pressure, pulse, oxygen. You're staying in the recovery room usually around an hour or 2 hours. And then once you are stable, level off, or that you are at a point where you can be transferred to your room and a room is ready, you will be transferred to the North Tower 4. That is our orthopedic unit. It also has a surgical unit and some medical unit. Depending on what time of the day your surgery is, when you get up to the floor, therapy may be coming to start, to getting you up out of bed, maybe as soon as like 30 minutes to an hour after you get up to the floor. Because we have found that starting moving, getting up is beneficial in decreasing the risk of pneumonia and also helping with that recovery for your knee or your hip. We will talk about pain medications a little further in the discussion, but just to know that this is something that we are very aware of. We want you to be at a point where your pain level is that you can work with therapy and can start doing some of the activities that we're requesting with your pain at a level that is manageable. Once you're up on the floor, you may have oxygen, and one of the best ways to get off of the oxygen is by using what's called an incentive spirometer, and that's a picture of the little device that's in the middle of this picture here. There's a you breathing in and out, and you will be instructed on how to do that. It's a very important part of your recovery because it helps decrease the risk of pneumonia as you're able to get that anesthesia out of your lungs. Other drains that you may have, it's called a JP drain, and this is a bulb-like drain that some of the surgeons use to help get some of the drainage away from your incision. That will definitely be discontinued before you're discharged. Some of the patients may have a Foley catheter, which is a tube that goes in your bladder and empties the bladder for you. Again, this will be discontinued usually before the next morning. For your bathing, we will continue to use these special type of wipes that are similar to that Hibiclens that you used before surgery. And in bathing, we do say that if you, when you are home, that you can take a shower. Just make sure you have a coach or someone with you. And also that we ask that if you have the certain type of dressings, that you would wrap them with saran wrap or something else that's called press and seal that you can get by the saran wrap area in the store, that you do wrap your incision so that it does not get wet. For your diet, we start out everyone with clear liquids. We want to see that you can tolerate those before you start advancing to a regular diet. We want to make sure that you're having bowel sounds or that you're passing gas so that you can tolerate the real food. But most of our patients progress to that very quickly. And one of the other things for the wound care, most of our patients will have the type of dressing that's on the top of those items there on your right. It's called Mepilex, and it looks like a big Band-Aid, but it's not Band-Aid material. But the great thing about it is that it can stay on for 7 days, so you do not have to change your dressing each day. So your skin really likes that, and that it's not having to pull that off each day. It also helps with decreasing the risk of infection because it's not opening up that area to possible bacteria. There's another type of dressing that your surgeon will talk with you prior to the surgery, but whichever type of dressing that you have, you will be given instructions in your discharge papers and instructed by the staff prior to your discharge. One of the complications for the type of surgery, either total knee or total hip, is blood clots. So we're very important to prevent the blood clots. One of the best ways to do that is getting up and walking. Another thing that you will have when you're in the hospital is called SCDs, or sequential compression devices. There's a picture of that on the right hand that will go on your calf, on both lower calves, and it's like a pumping from your lower legs to help that blood get pumped back up towards your heart. All of our patients will be on some type of blood thinning medicine, and your surgeon will be the one to order that. All of our patients are a risk of fall, and while you are in the hospital, you will have a yellow wristband. You'll have one of those cute little yellow non-skid stockings for you to wear. You'll have a bed alarm because we do want you to call the nursing staff or the staff member to get out of bed and to assist you up to the bathroom or out to the hallway, because we do not want you to fall on that new knee or new hip. Thinking about going back home, you'll be working with the discharge planner in the hospital, but these are things that we've already started to talk about even before the surgery, as where are you going? We want you to have a plan As far as that, we do encourage that most of our patients do return home, but also a backup plan if there's someone else that needs that, if you're going to someone else's home, or that you have, again, that you have the coach that's going to be there with you. To think about who's picking you up at the time of discharge and what type of vehicle. Now, everyone's either a knee or a hip. Patients that are having hip surgery, the therapist will be going over some hip precautions, but one of them is that whenever you sit and wherever you're sitting, your hips need to be higher than your knees. So when you think about the car or vehicle that you're going to be going home in, I want you to get in there before surgery and think about, okay, now are my hips higher than my knees when I'm sitting here in the front seat? Or do I need to sit in the back seat? Or do I need to put a pillow or a blanket there so that my hips are higher? And for knee replacement surgeries, you'll find similar thing as far as like, do I need to sit in the front with my seat all the way back? Is that the most comfortable? So if you practice before your surgery, that you'll at least have an idea what has worked best for you. Again, we're talking about managing pain when you will go home. You will expect some pain. It does take time to heal, but again, we will talk about some options so that the pain level is manageable for you. You will receive paperwork including your medications that you're on right now, medications that you will take home with you, which is a stool softener, some type of blood thinning medicine, and then your pain medications. It will also include your future appointments with your surgeon and with therapy. So the next series are some videos from physical therapy and occupational therapy that will go through some information regarding your home and your body in getting ready for surgery and after.
Hi, I'm Caitlin. I'm a physical therapy here at Carl.
And I'm Allie. I'm with occupational therapy. And we're here today to talk to you guys about what to expect from us and what we'll expect from you, and then what to prepare and how to prepare for surgery.
So before surgery, we'd like you to exercise your entire body. So if you're getting surgery on your leg, we don't want you just exercising that leg, but your arms and both legs. We'd like you to do cardiovascular exercise 10 to 15 minutes a day. Whether that be just going for a couple walks or cleaning around your house, doing a stationary bike. That'll help maintain your range of motion and keep your cardiovascular fitness and endurance up, as well as maintaining your strength. We're also going to give you a list of pre-op exercises that you can do prior to surgery just to maintain or increase your strength and make recovery after surgery easier.
So we're also going to want to make sure that you have your home completely ready before surgery so that you don't have to do anything different after surgery. So for stairs at home, you want to make sure you know how many stairs you have, like going into your house or up the steps to, say, your second level, or down to a basement if you need to go down to a basement. If you do have stairs into your house or inside your house, you want to also check out the railings at home. If you do have railings, or if you don't, it would be a good idea to put those on again before surgery. And if you do, you might just kind of make sure that they are sturdy and good for you to be able to use and put a good amount of weight through. Okay. You also want to check out your chairs at home. So here's where I'll explain kind of the hip precautions. So if you are getting a new hip instead of a new knee, you will have some hip precautions. Some surgeons are different than others, but usually they just have about 3 hip precautions that they want to make sure that you know. The first one would be that they don't want you to go past a 90-degree angle from your hip to your knee. Okay, so this is your hip, your torso, and then this is your legs. Okay, so we don't want you to be going like this down to your feet or bringing your legs up to you. Okay, so say getting to your socks, shoes, things like that, or even trying to pick something up off the floor. So they don't want you to do that one. They also don't want you to cross your legs, and they also wouldn't want you to bring that leg in and turn it in, okay? So for hip precautions, if you're going to be looking at your chairs at home, you will want to make sure that they are at a good height for you, okay? Kind of is dependent on your height, so we can't tell you exactly the height that's great, but we want to make sure that you check these things out before surgery when you don't have the hip precautions. So make sure that it is at a good height for you and that your knees are not above your hips, okay? That would mean you're too low and the chair is too low. Or any surface at all that you sit down on at home, whether it's a chair, a shower chair at home, your toilet, anything that you sit down on, you want to make sure that it is at a good height for you. We can also then talk about if you have a favorite chair that you absolutely love and you want to sit down on it, but you know it's going to be too low for you, you can fold up some either towels or blankets, something that's going to be a little more firm, and sit it at the seat of the chair. It'll raise it up at least just a little bit, but it's not going to do a lot. So it won't need, if the chair is way too low, it's not going to work perfect, but it will work a little bit. All right, so we just also want to make sure that your toilets and your bathroom are at a good height for you. So again, any surface that you sit down on at a good height for you. It doesn't always mean that if you have hip precautions, yes, obviously you want to make sure it is at a good height, but even if you had a new knee, sometimes it's just harder to stand up from a low surface. So again, it'd be good to raise that up. So a toilet seat, if it's too low, you can get an elevated toilet seat. And we can talk about that in a little bit. Also in the bathroom, if you feel like you need to sit down to shower, you can get a shower seat or a tub transfer bench. And you want to make sure that those are also adjustable in height so that they, again, are at a good height for you and you wouldn't break any precautions, okay? You also want to make sure that your bed at home is at a good height for you, but also that it is in a good spot in the room so that you have a good path to walk to it, because you will be using a walker. So as long as you have a good path to get to your bed and can get into your bed without breaking precautions, it would be really great. You also want to check out your door frames at home and make sure that they are wide enough for a walker to fit in through. Usually we say most walkers are about 24 inches wide. So just kind of dependent on that and see if you would be able to get a walker in and out, okay? Because you wouldn't want to go home and then realize that you can't get into, say, your bathroom when you need to after surgery. And then it's also a good idea just to pick up any throw rugs at home. They are a tripping hazard, especially with using a walker. So really good idea just to pick those up before surgery so you don't have to do it after as well. All right, so now we're going to talk about just different pieces of equipment that you might look into getting either before or after surgery. And that will really help you just be more independent and also make sure that you are maintaining those hip precautions as well if you are having a new hip. So these pieces of equipment are going to be completely optional, but they're, again, really, really great for you in maintaining those hip precautions, okay? So in the prior slide, I did mention the toilet seat riser. So this can come just kind of a basic design with nothing on it, or it can have little arms on it as well. So if it has the arms on it, it's gonna, if you don't have, say, a grab bar next to your toilet, the arms can kind of work as that to use to push up from your arms to help stand up. Also, the toilet seat riser is just going to make the toilet seat higher, so it's going to be even easier to stand from the toilet as well. So there's definitely different designs, kind of just check some of them out, but I always recommend if you are going to get a toilet seat riser, you might as well get ones that have the little arms on it as well. So the next one is the tub transfer bench. So this is going to be really helpful in getting in and out of your tub if you do have a tub. So 2 legs sit on the inside of the tub and 2 legs sit on the outside of the tub, and then you just sit on the outside part scoot your bottom in and then bring your legs into the tub as well. And then the complete reverse to get out. So this would eliminate the need to ever step over the tub ledge to get into the tub. Obviously making it much safer to get in and out. And again, this can be adjustable in height, so make sure that it is at a good height for you. And the next piece of equipment is the shower seat. And this, again, will just it would just sit on, say, the inside of your tub or the inside of a walk-in shower, either one. It will just give you something to sit down on if you do need something to sit down on while you're showering, and if you fatigue easier. Or maybe you have some pain after surgery, something like that. Again, make sure it is adjustable in height and it has a good height for you. Okay. And the last piece of equipment is the bedside commode. This would we really only recommend using this if you have a bathroom that's up on a second level, say your second story of your house, or in a basement or something, where you would have to go up and down many stairs just to go to the bathroom many times a day. So this bedside commode would just sit next to your bed or your chair, wherever you're at, so that you wouldn't have to go up steps to go to the bathroom. However, we do recommend for you to get up and walk to the bathroom if it is accessible for you. So we want you to be getting up, doing that light activity of just going to the bathroom multiple times a day. So only recommend this if it's going to be very difficult to get into the bathroom. Okay?
As therapy was talking about some equipment that you will see will be helpful at home, all these pieces of equipment that you see are optional. Usually they are not covered by insurances. And you can look at the toilet risers. If you are looking at them, the toilet risers with the handles are very helpful. And they would talk about the patients that are hip patients because of your hip precautions, but also knee patients. They tell me that they have found this to be very helpful. One of the things to think about when you're looking at the toilet risers, though, is your toilet, is it a round toilet or is it oval as far as getting the right toilet riser to fit for your stool? If you already have a taller stool, you may not need the toilet riser. The shower chair. We do really highly recommend that you have this shower chair because your stamina, when you might be a little bit weaker when you get home at first, or your strength. So it's important to have that in there in the shower to be able to sit while you're taking a shower, or just for an extra precaution. The bedside commode, that would only be used if your bathroom was on a different level than what your normal living space or your bedroom was located. On the whole, we don't recommend a bedside commode because truly we want you to get up and go to the restroom and to be helping to walk back and forth. And now the therapist is going to talk about the tub transfer bench.
So now I'm going to tell you guys and show you how to use a tub transfer bench to get into the tub that you might have at home. Okay. So I'm already sitting down on it, but again, anytime you sit down and stand up, you want to make sure it's already at a good height for you, so that we don't break any kind of precautions. And then once I'm sitting down on the outside part, I want to make sure that my knees do not go above my hips like this. Okay, this is what we don't want. So if I were to bring my knees up like this and try to scoot all the way in, that would be breaking the hip precaution. Okay, right now I'm at a good 90-degree angle, so we're sitting good. So first I would just kind of scoot around like this, so I'm on that edge of my tub transfer bench, and then I would just scoot over. Okay, so I'm just scooting my bottom over with my arms. Okay, so that way my bottom is actually inside the tub, and then I would just bring my legs over like this. so that I'm not trying to bring them way up here to try to get over, okay, but just kind of slightly bring them over and into the tub, okay. And if you need to scoot over a little bit more, you're at a good spot inside the tub. And then you're sitting actually in the tub, and then you'd pull the curtain. This would also give you something to sit down on while you're in the shower as well. So to get out, you just do the exact opposite, okay? So you would kind of bring your legs out, again, making sure they're not going above 90. Now, if you do feel like your tub ledge is just too high for you to be able to maintain that, you can kind of lean back a little bit, and then that will make it a lot easier as well. So then my legs are on the outside, and I'm just scooting to the edge, and then I bring myself around, and now I'm outside of the tub. And that's it.
So after surgery, we'll have you use a rolling walker. So that's a walker with 2 wheels on the front only. We would like you to use this type of walker versus a 4-wheeled walker, as this one is going to be more stable for you. You're going to be able to use your arms more, and the 4-wheeled walker is more for balance, and you're not able to really put your weight on it. So typically insurance, if you don't have one, insurance will cover it as long as you haven't bought or they haven't gotten you one in the past 5 years. Case management at the hospital can assist you with obtaining this device prior to going home. You can also borrow it from a family member or find it at like a Goodwill or a store as well. There's no need to bring your walker into the hospital. We'll have one for you to use, but if you want to bring it in so that the therapist can fit it to your height, then we would do that for you.
Alright, so now we're going to talk about some adaptive equipment that you can use and purchase so that'll make things a lot easier for you to get dressed and to bathe after surgery, especially if you have hip precautions. So if you get all this equipment together, it would be considered a hip kit. You can get these at different medical supply stores or online, a little bit cheaper sometimes, but you might not need all of this all together, so you can also get them individually as well. I'm going to go over each one and how to use it so that it would help you the best, okay? So first we're going to use the reacher. It's going to look just like any other reacher. You can get things off the ground, pick things up. Again, if you have those hip precautions and we don't want you to bend over to get to something on the floor or your feet, because we don't want you to go past 90-degree angle, then this will be really, really handy for you. Anything falls on the floor, you can pick it up. But you can also use this reacher to push your socks off. Okay, so if you have this, if you have a reacher that looks like this and it has a little prong on the end like this, then you can use this prong part to push your socks off. So say it's right here, I'm going to push it all the way off around my heel. Alright, and so you see how I'm not bending all the way over to get my socks off. I'm using the reacher to allow myself to almost extend my arm to get down there. So I push it all the way off like this, and now it's on the floor. Okay, so then you use the reacher part to actually pick it up. And I never had to bend over to actually take my socks off. Okay, so the reacher is really, really helpful for that. You can also use this to put your pants on as well. So you would just put this around the waistband part and then drop it down on your the side that had surgery on, and just place your foot in, and then put it on this side and place your foot in, and then stand up and pull it up. Okay? So that's your reacher. Again, really, really handy. But we can, whenever you do come for surgery, the occupational therapist will also work with you on how to use this adaptive equipment for you, especially people who are having new hips. Okay, those with new knees, a reacher is going to really help if you have something on the floor, or you simply don't have a range of motion in your knee that you can't get down to it to take your socks off or anything like that. Okay. Not all of this equipment is always necessary for every single patient, so just kind of go over it and see what you might need, okay? So that's the reacher. And the next one is a long-handled shoe horn. Okay, it's going to help you to put your shoe on, again, so that you don't have to bend all the way over. So if I have my shoe here and I am not able to get my heel into it, I would put this on the back of it and then I'd slide my heel in, okay? So again, now my foot is all the way into the shoe and I wouldn't have to actually bend over to get my heel into my shoe. Now if you are going to be wearing shoes that have a tie like mine, you would need some help to tie your shoes, or you could get elastic laces that would basically be tied for you. Or people use shoes that are just slip-on shoes, and then it would be a lot easier. You wouldn't have to tie it or anything. However, those shoes are a little bit tighter, and so people have a lot harder time actually getting their foot into it. So that's why the long-handled shoe are going to be really helpful to get your heel all the way into it. And again, you don't have to bend all the way over to your foot, okay? So the next one is a long-handled sponge, okay? So this is going to be really, really helpful in the shower, okay? So say you are sitting down maybe on your seat in your shower, or you can stand, but say you're sitting, you get this all soapy and on water, and then you can wash your lower legs and your feet like this without ever having to bend over. Same thing if you're standing, and you can just do the same thing. It doesn't have to be a sponge, it can be a brush or a loofah, anything that you would like, you can find. It's fine. Just make sure that it has a longer handle again so you don't have to bend all the way over to your feet. Okay? And the next is actually we'll go with the, this is a sock aid, okay? So this will allow you to put your socks on, again, without bending over, okay? So this is how you use it. I always put it against myself so that I have something to kind of push onto. And then you just put it all the way onto the sock aid. You put your sock all the way onto the sock aid. So it'd be just like this, okay? And then you drop it down by holding onto the ropes. Just drop it on the floor, okay? Then you put your foot into it and just pull it all the way up. Like that. And then you just drop one down and it's done. And that's it. So when you have your sock on, you never had to bend over to get your sock on. This is a sock aid, okay? Really, really helpful, especially for those who will have those hip precautions. You will need to use that if you're going to want to do this independently, okay? So the next piece of equipment is the dressing stick. It's going to look just like this. This is used if, say, you have a reacher, but your reacher does not have this little prong on the end of it, because not all of them do. So remember, with the reacher, this prong helped us to push the sock off. And again, if you don't have that, then you won't be able to use that. The dressing stick will do the same thing. So you just push like this, you put it around your sock, around the heel, and just again, push it all the way off. Now it kind of sometimes stays on to the dressing stick like this, but sometimes it falls on the floor, and then you would have to get your reacher and pick it up. So that's why I like to just use one of these. So if you just have the reacher with the prong, you would only have to use one piece of equipment instead of two. But if you don't have one with the prong and you want to get the dressing stick, you can do that as well.
So there are a list of things that we'd like to see you do before you go home. This includes getting in and out of bed, walking at least 50 feet with therapy, getting to the bathroom, and being able to dress yourself, bathe yourself, and also toileting. So getting in and out of bed, we want you to be as independent as possible, just like you would be at home. Basically, we want you to have the bed flat, getting out of bed just as close to your home situation as we can make it in the hospital. We would like you to also walk a minimum of 50 feet. So 50 feet is typically considered the minimum household walking distance. So if you're able to walk that, then you should be able to go safely home. Getting up to the bathroom is important. You want to make sure you can get on and off the toilet, just functional things that you'll need to get done at home. includes dressing and bathing, mentioned before, using any adapted equipment that you might need to perform dressing and bathing activities. We'll also want you to perform stairs prior to going home as well. We want to make sure that you are able to get in and out of the house in case there is an emergency and you need to leave, or just being able to leave to get to doctor's appointments and various activities. We also want to make sure that you're able to get to the necessary rooms. So if you have a second floor, getting to the bedroom, getting to the bathroom on the second floor, those kind of activities as well. Generally, we would like you to have 24-hour assistance after surgery. And this is like a family member who can help you with things like cooking, cleaning, laundry, just those extra tasks that might be a little bit harder as you're using a walker and recovering from surgery. And this can be either one person helping you all the time, or it can be various people, maybe someone during the day and someone at night, just somebody who can help you, just having someone at home. So if you have any stairs at home, we'd like you to perform them before leaving the hospital. So now I'm going to go over how we would teach you to use the stairs. So assume that my left leg was operated on, either a knee or a hip. We'll consider this my bad leg, but it's not your bad leg, it's just your operated leg. So the rule is up with the good leg and down with the bad. So when you're going up the stairs, you'll go up with your non-operated leg, your good leg first. So we'll go up with the right, since I didn't get an operation on that, push through it, and then bring up your left. And we'll have you take just one step at a time when you are first learning how to do the stairs. So up with the good, and then bring your other leg up. So when you're going down the stairs, you'll bring your operated leg or your bad leg down first. So in this case, it'll be my left leg. So I'll come down with the left leg first, and then bring my right leg down. So down with the bad leg, and then bring the other leg down.
As we discussed, it's your coach's role or a couple different people. It's just recommended to have someone to stay with you for 24/7, at least about 3 to 5 days after your surgery. And again, this can include your coach, because your coach is there to assist you to get in and out of bed as needed, assist you in getting dressed as needed, or to prepare meals. And they also are very important to help keep track of your medications, to write those down as far as when is the next time that you're to take your medicine, so that there isn't a short amount of time in between taking your medicine, that you're taking them as your doctor ordered. That your coach is also that person that may take you to your doctor's appointments or to physical therapy appointments. And as I say too, that coach is there, someone to help you along, to kind of cheer you along with that. They don't need to have their pom-poms ready, but they're that person, that second set of ears, that person for encouraging you along the way.
Hi, I'm Cindy, one of the nurse case managers. I'm here to talk about case management and social work. So I'm going to talk about what the case manager does. The case manager will come and see you after you have surgery and complete a thorough discharge assessment. She will work with the physician to make sure that you have a safe discharge. She'll arrange any orders or any medical equipment that you need if you have not already received that from the physician's office. She will work together to complete the most effective, safe discharge. As you can see from the PowerPoint, it's equipment. We can also assist with financial concerns, but mostly that is a social worker, and coordinate discharge services. The social workers can help with food assistance. Do you have food prepared ahead of time? Do you have someone that can bring you food? Do you have access to the grocery store? They can also help with financial assistance. Do you have any concerns about paying your bill? They can help you with the Cardinal Financial Assistance Program. Home activities. Do you have stairs? Do you have access to get up the stairs? Do you have help at home? Medicine. Can you get your prescriptions filled? Are they affordable? If not, they can assist with that. And transportation. Do you have a ride home? Do you have a friend that can take you? And caring for others can also be part of your post-op care. Do you have support from your church community or community resources? Social workers can help you with those services.
When you return home, we request that you continue to think about preventing infection by using good hand washing, clean towels, still limiting your exposure to pets. When you're going home, you may go home with your surgeon ordering outpatient therapy to start within a short period of time. While we encourage independent recovery and getting around at home, in some instances a patient may need home health services. Those patients that qualify for this type of service, usually a nurse will visit a couple times for a week or two, along with physical or occupational therapy, seeing you for 2 to 3 times a week for those 2 weeks. Again, if your team prior to your discharge from the hospital will be involved with ordering if you are going home with outpatient or with home services. For your follow-up, your appointment with your surgeon is approximately 2 weeks after your surgery, and that may be with your surgeon or with a physician assistant. The other thing that if you do have staples, we want to make sure that the provider has made some arrangements that you have those removed either in the office or in the home setting. While we encourage the independent recovery at home, there are some instances when patients may require home service. That would include nursing and a physical therapist, but patients will need to qualify for this. Most of our patients are going to outpatient therapy within a short period of time. The discharge planner will assist you in what your physician and your team has ordered for you regarding therapy, outpatient therapy, or home services. And going home, to help improve the healing process, we ask that you be mindful of, as far as your diet, in increasing protein in your diet, which will help in the wound healing. Thinking about protein included in your meals, which would include like lean cuts of meat, poultry, eggs, dairy. You can get protein shakes or protein smoothies. Those are things that you can think about picking up prior to your surgery so that you would have them available. A lot of patients tell me that their appetite's just not what it, is a little decreased after surgery. So you may think about those protein shakes or protein smoothies that you can have interspersed between your meals, or eating maybe a little more frequently meals throughout the day. Also think about your vitamins that will help promote with the healing, and in fruits that you would eat as strawberries, cantaloupes, type of citrus fruits, vegetables, the dark green and leafy as broccoli and spinach. Now, the disclaimer, or to say to patients that are on a certain type of medication that their doctor has said to avoid those vegetables, please do. But just to keep in mind some things that you could also do to help in your healing process. And always think about increasing your liquids, increasing your water intake. That's going to help with your, again, helping with your decreasing your risk with your lungs, with pneumonia, and so we encourage that you drink plenty of water. We ask that you limit beverages that have sugar. If you do drink a soda, then make sure that you have a glass of water with that. We do ask that you avoid foods, fried foods, or processed foods, sugary sweets. Again, with just things to help in keeping your healthy lifestyle. You will be taking medications, several medications, as I mentioned earlier. This has been shown to be very effective in pain control, and like you said, our goal is you're going to have some pain, but we want the pain manageable, that you're able to continue to do your exercises and getting up and walking at home. This plan for pain management, your surgeon will work with you, and you'll be starting these in the hospital. That would include the acetaminophen, which is Tylenol, includes muscle relaxants, narcotics, and anti-inflammatories, other medications. As you see, in the past, we may have just relied more on narcotics, but we're trying to get away from using that as many narcotics and looking at different options, which has really helped. And continuing on after your surgery. The one other thing that you'll receive when you're in the hospital is gel cold packs. They'll start using those in the hospital. They usually are available for you to go home with. If you don't, then just make sure that you have some cold packs at home in your freezer or to be using. It's very important to continue to use that ice to your knee or your hip as instructed when you're at home. We want you to continue that because that's also another way to help with pain control. Also just positioning maybe in a different type of chair or using a pillows to help with the positioning to help with the pain control. In talking about though medication and narcotics, and your surgery itself, one of the complications can be constipation, because anesthesia, when you have anesthesia, it slows down your digestive system and slows your different organs there that you can be more susceptible to constipation. So symptoms with constipation would be having fewer than 3 bowel movements a week, straining while you're having a bowel movement, if you're having hard or dry larger stools than normal, or if you're having abdominal pain, or not feeling relief after having a bowel movement. Please contact your surgeon's office or your primary care office if you're using stool softeners or laxatives and you've not had a bowel movement within 24 to 48 hours, if you've not had a bowel movement in 3 days, or having a fever. And we ask that you call patient advisory nurse or obtain your surgeon right away if you have constipation that's lasting more than 4 days, if you have bright red blood in your stool, or the abdominal pain or inflammation or unexplained weight loss. And again, your number for the patient advisory nurse is in with your paperwork and on the sheet of phone numbers in your joint replacement surgery book. Things to think about when you're at home, again, possible complications. We're very mindful of preventing blood clots, but every once in a while that may happen. So if you have swelling in your thigh or calf or ankles that's not improving or is a change, now I will tell you, you are going to have some swelling, there with a knee or a hip replacement. But what I'm talking about would be a change in the swelling or increase, or if you have pain or tenderness at the calf area, please call your surgeon's office. And if you're having a question about that, please call us and we'll ask you the questions or kind of go through some information to make that determination if we need you to come in to be evaluated or what's the next step. If you have sudden chest pain or shortness of breath, we request that you call 911. For signs of infection, again, as we said, we're doing all these different things and you're assisting with us in decreasing that risk of infection. Sometimes when you go home, you might have a little bit of a temperature. A lot of times that's more, again, because of your lungs. So I encourage you to continue to use your incentive spirometer when you go home, not to have that on your bedside table or at your end table in your living room, not as a decoration, but to use that frequently, especially those first 3 to 5 days after you've gone home. But if you do have a temperature that is above 101.5 lasting more than 6 hours, or you look at your incision and there's some drainage there, or there's increased redness around the dressing, or that your pain or your tenderness at your incision is not relieved by your pain medication, again, please call your surgeon's office or the patient advisory nurse for further instructions. Patients are interested about when can they start driving. That depends on which leg you had your surgery done, or your right knee or your right hip. You need to be off of daytime narcotics and not using your walker. Most of the time we recommend that you talk with your provider at that 2-week follow-up appointment. Usually it's anywhere between 2 to 4 weeks that they will release you to drive. The other thing that we recommend is that if it's been a while since you've driven, your coach or someone can be with you to practice driving in like a parking lot prior to you going to your appointments. We ask that you avoid elective or medical procedures at least 90 days or 3 months prior to surgery. Also dental work, and that's including cleanings, dental cleanings. We ask that you avoid those for 3 months after. Now, it is different if you do start having tooth pain or a cracked tooth. Then you would need to call your dentist and also your surgeon, because you will need an antibiotic to take an hour prior to your dental appointment. Your surgeon will also talk with you about the recommendations for antibiotics prior to dentist appointments in the future. If you do have any illness or symptoms of infection or questions, you call your surgeon's office, which is the number of 217-383-9400, or call patient advisory after hours. Again, all the contact information is in your booklet, and please refer to that. But if you have any questions at all, please don't hesitate to call us, because as we said, we're all a team here together, and we want you to be successful, and we're here to assist you throughout this time. Thank you for taking this time to view and listen to this presentation. Please reference to your booklet with a joint replacement surgery booklet. I hope it has provided you with the information that is needed to guide you through your surgery and during your recovery. Should you have any questions, as we said, please contact your surgeon's office again at 217-383-9400. Thank you.